So inborn errors of metabolism, chapter 22, 499 is the page number if anyone joins late. So these are genetic disorders, okay? It travels within the family. And these are usually rare genetic inherited disorders in which the body cannot turn food into energy because body does not make certain enzymes for the breakdown or for the metabolism of that particular food. So that's why it is an error in metabolism. And by birth, the some children inherit this. So that's why we call it as inborn errors of metabolism. Okay. So it will happen when both the parents are carriers of certain recessive genes. Okay. And it completely depends on the chance. Okay. It's not compulsory that parents who are carriers, if they join together and produce a child, the children will have the genetic disorder. It's not completely, we can't say that 100% sure. Okay, it completely depends on the chance how the genetic mutation takes place, how the genome system develops in the unborn child. Okay, so here you can see the black part, that is the recessive gene. Both the parents have that. Okay, and 1 in 4 is the chance of a child being born with the disease. Okay, that is a child with inborn errors of metabolism. All the other children, either they can be unaffected, okay, or they themselves will be carrier children. Okay, the disorders are usually caused by defects in specific protein enzymes that help break down and metabolize parts of food. Okay, either the enzymes are not working or the body is not producing those enzymes at all. Okay, this is what happens in inborn errors of metabolism. There are different diseases. Okay, so if protein is the situation, okay, the body cannot digest protein. Usually it could be phenylketonuria or maple syrup urine disease. Okay, if the child is not able to metabolize any organic acid, okay, glutaric acidemia, propionic acidemia, okay, if the child is not able to break down lipids, fats, okay, carnitine uptake defect, and other diseases like galactosemia, cystic fibrosis, congenital adrenal hyperplasia, okay, these things can happen. These come under the classification. Phenylketonuria, PKU disorder, very rare, okay, and also in Indian population, it's very rare. Usually, phenylketonuria, still the cases that you see is mostly in the Caucasian um, race. Okay, the whites we call them Caucasian race. So PKU is a genetic disorder in which there is a buildup of phenylalanine. Okay, phenylalanine is an amino acid. Okay, that it makes protein. Okay, proteins are made up of certain proteins, not all. Certain proteins are made up of this essential amino acid, phenylalanine. Okay, and it is an essential amino acid. You get this from food. Your body cannot produce this. So it is contained in a lot of different food, but it is not just limited to fish, pork, cheese, and breast milk. Okay, there are other food as well. So breast milk also, the child cannot be breastfed. If the child is born with this disorder, breastfeeding has to be immediately stopped because breast milk has phenylalanine and the child cannot metabolize phenylalanine. Okay. If you can't metabolize certain things in your body, it will build up in your body. This is what happens. So phenylketonuria is what happens here. As you can see, phenylalanine comes inside the body through food sources and it has to be converted. Okay, phenylalanine hydrolase is the enzyme. Hydroxylase is the enzyme, PAH. Okay, this is the enzyme. This is supposed to do the work. PAH, this enzyme is supposed to do the work in converting phenylalanine into tyrosine. Okay, into L-tyrosine. But if this enzyme is not present, if the child's body, newborn baby's body, is not able to produce this enzyme, it will convert into pyruvates, lactates, acetates, phenylpyruvates, phenyllactates, phenylacetates, and it will spread across the body through blood, because whatever cannot be metabolized, the blood will absorb it. Okay, and too much of these pyruvates, lactates, acetates in the blood will cause symptoms, inflammation and all, which is not normal. Okay, very high amount of phenylalanine derivatives in your blood is is dangerous. Okay, the child will start showing symptoms of indigestion. Immediately they will do a test, okay, to rule out this situation. So if the test is positive, immediately the hospital will decide to stop breastfeeding, because breast milk also has phenylalanine. The child will be fed on plant-based milk, because any milk, not just breast milk, cow's milk, buffalo milk, any milk, okay, any mammalian milk will have phenylalanine. That has to be stopped. Okay, lifelong it has to be stopped. So what are the signs and symptoms? The child will be born with a very small head size because the development is not taking place. There is a very musty odor in the child's breath, okay, and skin and urine as well. Mental retardation, behavioral and social problems, and if it affects the circulation of your brain, central nervous system, the child may suffer from seizures as well. Okay, occurrence, it is very rare, 1 in 10,000. Okay, they can get this disease, and usually Caucasians and Oriental, these are the Southeast Asian race, not Indians, but Korean, Japanese, okay, and Chinese and all, they come under the Oriental race. So they are also they're also at the risk of developing the disease. Okay. Prognosis, if treatment is followed, no significant effect on life expectancy. If treatment is not followed, PKU can lead to intellectual disability at the end of first year of life. Okay. And this can lead to the ADHD as well. So as soon as possible, if you're able to diagnose this, that much better. If the diagnosis is delayed, more will be the disability the child may face. Treatment, newborn takes a PKU test. When the test is positive, the newborn's parents will be instructed what kind of diet the child has to follow lifelong. Okay, so all the phenylalanine based food, okay, will be described, and this has to be restricted. As long as phenylalanine is avoided, the child should have a long life, symptom free. Okay. Then you have galactosemia. So galactosemia, the name meaning of it is galactosemia. Galacto means galactase. The galactose, that is a glucose, form of glucose found in milk. Amia, in blood. So too much of galactose in blood. So galactose you will only get from milk. Okay. That is a carbohydrate. Galactose is the only animal carbohydrate. Okay. Found in milk. So lactose is a sugar that is found in milk. Lactose can be, when lactose is metabolized, it divides into two parts: glucose, which can be used for energy, and galactose, that can also be used for energy. Okay. In normal situation, when a child is normal, the galactase enzyme will convert galactose into glucose. Okay. It will undergo this sky blue galactose will go one more step, and it will become glucose, which will be used for energy. But if this enzyme, GALT enzyme, is not present, okay, there is nothing that can convert galactose into glucose, and your body does not know what to do with galactose. Okay, so galactose will increase in your blood. The concentration will increase to toxic levels, and it will cause kidney failure, enlarged liver, cataracts, brain damage, etc. Okay. So, what are the signs and symptoms of galactosemia? There is swelling on the brain, pressure around the brain. The child will not have an appetite, kidney issues, because the kidneys are trying their best to take galactose out of the blood. Okay, so kidneys are overworked. So it could lead to kidney issues, spitting or vomiting, liver failure, jaundice, sepsis. Okay, too much of galactose in the blood can attract a lot of bacterial or viral infection. Okay, so how is it treated? The only way is diet restriction. Okay, from the very first few days of life. As soon as you see when the child is drinking breast milk and throwing up, vomiting, suffering from indigestion, do the test. Find out if the child has this enzyme or not. If the child's body is not producing this enzyme, stop milk-based products immediately. No breastfeeding. Only soya-based formula is allowed. And until and unless the results are definitive, the child will be continued on soya-based formula. Okay, not with just one test. Some other test also has to be done, which shows the definitive present absence of GALT enzyme. In that case, till that definitive diagnosis has been, the results have been given. Till then, soy-based products has to be given. Fructoseuria, inborn error of fructose metabolism caused by deficiency of fructose kinase in liver. Fructokinase is another enzyme which your liver produces. Okay, and fructose is a sugar that you get from fruits. Okay, so here fructose is not converted to glucose, just like how galactose was not able to be converted into glucose because of the absence of enzyme. Fructose is also not converted into glucose in liver. Okay, so that increases the fructose levels in your blood, and that is excreted in large amount in urine. It will lead to fructose urine. Usually it is a harmless condition, but symptoms can develop over time. Yeah. So in normal fructose metabolism, fructose will become a glyceraldehyde. It is broken down in your liver, okay, and then used by your body. But in fructose intolerant situation, it is accumulated in the liver and it will lead to toxic effects on liver, kidney, small intestine. And also it can lead to hypoglycemia. Fructose 1,6 biphosphatase deficiency. So here you can see fructose 6 phosphate. Okay, on the sixth carbon of fructose, phosphate ion is present. There is phosphofructokinase. Okay, that converts this fructose 6 phosphate into fructose 1,6 biphosphate. Okay, because one extra phosphate they got from this enzyme. The fructose 6 phosphate already had a phosphate, but reacting with this phosphofructokinase enzyme, it got another pair of another one more molecule of phosphate. So it became biphosphate. Now it has two phosphate, one on the first carbon atom and one on the sixth carbon atom. Okay, so that is fructose 1,6 biphosphate. And in the presence of this enzyme in the liver, whenever the body goes into a stage of low glucose and all, it will signal the liver to release this enzyme in red, fructose 1,6 biphosphatase. Okay, it has to be this specific enzyme. No other enzyme can break this fructose 1,6 biphosphate. Okay, it has to be this specific enzyme, fructose 1,6 biphosphatase. Okay, only this can break down that extra phosphate ion out of fructose 1,6 biphosphate and create it back into its original fructose 6 phosphate. Okay, then the body can use this fructose to convert it into glucose and use it for energy. But in some children, this red enzyme fructose 1,6 biphosphatase is not present. They have phosphofructokinase. Okay, so fructose 6 phosphate is absolutely converted into fructose 1,6 biphosphate. But to go back to its original form, okay, that's not possible. So it will accumulate in the liver. Okay, this fructose 1,6 biphosphate will keep accumulating in the liver. Even when the body requires glucose, it is present in the liver, but it cannot be converted because it cannot be broken down and used up. Okay. So the child or anyone who suffers from this deficiency will suffer from hypoglycemia. Usually avoid fruits, anything that has fructose, honey, fruits, very ripe fruits and all, completely avoid it. And also avoid prolonged periods of fasting because when your body goes into a hypoglycemic state, fructose 1 phosphate is present in your 1,6 biphosphate is present in your liver, but it cannot help you out. Okay. Then you have Menkes disease. So this is copper deficiency. Either you're not having enough copper in your diet, or even if you're having enough copper in the diet, that is not getting absorbed by the small intestine. Okay. So that is copper deficiency. And that will affect the way how your central nervous system functions, your skin and hair health, bones, kidneys. Okay, these all will be impacted because of it. So in Menkes disease, what happens is that the image is given in the textbook as well on page 505. The child will have very kinky, that is zigzag kind of hair. Okay, it's not smooth at all. You take one strand of the hair and allow your fingers through that one single strand of the hair. It will have a lots of breaks and turns. Okay, sharp turns. It's not like curls. So that is deep pigmented, light colored, kinky hair. That is a classic sign of copper deficiency. So the body is not able to take up copper in the right amount, or your diet lacks it. That leads to Menkes disease. Clinical features: sparse, kinky hair, loss of developmental milestones, truncal hypotonia, that is, the muscles are very, very relaxed, okay? There is no stiffness at all. Failure to thrive, the child is not growing better, okay, not keeping up with their peers. Epilepsy, that is, convulsions. How to confirm this diagnosis? Take a blood test, okay? If the serum copper level or cerebroplasmin levels are very low, it confirms the test. And what is the treatment for it? Copper supplements. It will be prescribed. Copper chloride or L-histidine injection will be prescribed. Then you have Wilson's disease, opposite of Menkes. Too much of copper. Okay. This is also a rare condition in which your body absorbs way too much of copper, which is maybe because your diet has it, okay, or you're exposed to copper ores, or you are in a specific occupation like mining and all, in which, or metal industry, alloy industry, your body is constantly exposed to a lot of copper. So Wilson's disease will cause a lot of changes at the inner level, from the liver, hepatomegaly, enlarged liver, jaundice, hepatitis, inflammation of liver, high blood pressure, bleeding varices, cirrhosis. Okay, ankles and the bones will have rickets, joint issues, arthritis, central nervous system. If the child is already in school, their attention and performance will drop. Change in behavioral pattern. Incoordination, that is, what the mind wants the hands to do, the hands won't be doing it accurately. Then resting and intentional tremors, that is shakiness, okay, shakiness in the hands. Dystonia, when the child is crying, there will be not enough tone to it, okay. Sorry, dystonia is involuntary muscle contractions. And dysarthria, pain in the joints, excessive salivation, mask-like face. The child's face is without expression because lack of muscle tone. Dysphagia, pain and while swallowing food or swallowing anything, there is pain. And K. Fisher's rings. This is a classic case of Wilson's disease. A copper-colored ring, brown, okay, rust kind of brown ring, will start to develop at the edge of the pupil, okay, in complete circular form. That is Kaiser-Fleischer ring. That is copper deposits that takes place. Okay, excessive copper will start to deposit around your body. Okay, when it chooses the eyes, it will choose this part of the eye. Cardiac issues will be there, renal issues will be there. That's Wilson's disease. So that's about inborn errors of metabolism. If you have any queries, please mention in the chat box.